Today we are going to have this get together and in this Hall of Fame of ICLS. Today we are going to meet Dr. Sunanda Sina. She is from Bangalore and I welcome her on this platform of Hall of Fame.
अपना मूंग दाल
Yes, Dr. Sada has come. Okay. Is
दोल
okay. Right. So Dr. Sunanda Sina, she has joined us way back and she will tell you in her own words her journey right from what you call it zero to hero. Though I don't call it zero to hero. One of my students, he said that, sir, these sessions are good and we know because see, you are never zero. That's why I don't want you to start from zero. You can call it one to hero. No problem. Okay. So without wasting much of a time, I will call upon Dr. Sunanda Sina and she will tell you exactly how she has reached today's her position in cosmetology in laser fields. Okay. And I want all of you to take inspiration from her journey. We are always available for your guidance. And after her presentation, I will be giving one announcement, and that is very important announcement, but that will I will tell you at the end. Okay. So now I welcome Dr. Sunanda Sina. So can you see Dr. Sunanda Sina's screen? Do I have to make change over here? Spotlight for everyone. Okay. So now can you see?
Hi, sir.
Yeah. Okay.
Can you hear me, sir?
Yeah, I can hear you. Are all of you can hear and see Dr. Sunanda? If you are able to hear and see, then please type in chat box yes. Okay. So we know what is happening. Otherwise, we will talk and you will not hear anything or you will not see anything. That will happen. Okay. Yeah. They can hear. Yes, we can hear. Can you see, Dr. Sunanda? All of you can hear and see also. Okay, Dr. Sunanda, you can tell about you now. They are able to.
Yes.
Yeah.
First of all, good evening, everybody. Myself, Dr. Sunanda Sinha, and I thank you, sir, for giving me this opportunity to talk about myself, my journey. It is like great opportunity to me. So let me introduce myself. I am a BMS doctor. So it was like 10 years back, I was a BMS doctor. Now I am a cosmetologist. You can tell me I am a clinical trainer. I teach laser to dermatologists, plastic surgeons, gynecologists. I was working with a well-reputed company, which you all must be knowing, that is Alma Lasers. I was the clinical head for entire South India. Past 4 months, I quit that job and I have opened my own laser company. So how I started this journey was, as soon as I passed out from after my internship, I would rather say, after 1 month only I joined sir. So it was like sir knows how I joined him. So I had a fought with my dad is a doctor. So he has he's a proctologist. So he wanted me to join him. So I was never interested to join that. So I fought with him. I came to Mumbai. I stayed there for 1 year almost. So I joined Sir. I was with Sir for almost 3 months, I guess, sir.
Yeah.
Okay. So I used to morning Sir used to take class, and evening I had requested Sir that I want to just come and see what you do. Okay. So I used to go in the evening also. So my only job was to learn the things properly. So once I did that, I joined few clinics in Mumbai, so that I can I have a practical experience. So once I joined there, I could learn new technologies, new this thing. So my only motto was, up to 3-4 years of my career, initial this thing, I never cared about the salary what they were offering me. It was just the I wanted to learn, I wanted to explore new things, what kind of treatment they are doing, what kind of different procedures they are doing, what they are combining, okay, in different procedures. That was my ultimate motto. So after 3 or 4 years, then automatically it's money started flowing on your experience, no? Well reputed doctors, they have offered me jobs. Then after working with a well reputed doctors, I got a job in laser company as a clinical head for entire south zone. So that was I can say only for the name it was entire south zone, but I used to take care most of the parts of doctors from India. So initially when I joined the laser company as a trainer, so what would happen is, there was a very well-known doctor in Bangalore. So in 1 month only, I went and met him. That a sales guy introduced me to him. That she is from, she is a clinical head for our company. So she will be training now to the therapist and the doctors, whoever is purchasing the device. So later on, he just behaved as if when he came to know that I am a BMS doctor, so he did not shake hand with me. Okay, he did not shook hand with me, and he shook hand with the salesperson. So salesperson also felt bad, and I also felt bad, what I have done, not to shake hand with me. After that day I took a promise that I would be anything you ask in lasers, I should have that question. I should have that answer in my this thing, whatever question you asked about whichever laser you want. So I started reading books. Internet was the best thing. Instead of then many doctors I started meeting. I used to wherever there used to be demo, I used to run for it. Okay, whichever part of India, wherever they're appointing me, I used to just go. So by doing demos, by doing different this thing, I met different doctors. So what happens is, your confidence level also increases and your knowledge also increases. So now the thing is, I am not I'm very thankful that many doctors depend on my parameters. They know that I have left the company. Still they message me and they ask what is this parameters, how to we have done so many sessions, what is the next step we have to do it. And all are dermatologists and plastic surgeons, okay, and gynecologists. So it is I feel very proud, from where I started, and from my journey, I did not take help from anyone. Okay, it is everything is coming on my way, I'm just taking it. Last week I got an offer from well-known reputed brand VLCC for a pan-India trainer. Okay, I have rejected that job just because I have opened my own laser company. We are selling laser devices now. So just to take it forward, I have not taken that job because I wanted to concentrate on this thing. So there are you must be knowing this Urban Clap also. They have started with the laser treatments. A couple of months back, they also had offered me job. So these all jobs, I have not applied for it. They themselves have come to me. Okay. So it is like once you know the thing properly, yes, you have to work hard. You have to know the things properly. See, sir will tell you only the basics. Okay. Basics, how to like analyze things. Based on that, you have to work hard. Okay. So that's it. Like today, I'm the owner of a laser company called Pixel Perfect Laser. It is just 1 year baby, I can tell you. Okay. So we are planning, we are like working on getting the new devices, which is uh, like in like cheaper rates and with like good what to say results. Okay. So everyone is like, maybe 70% of them are this proctologist, and remaining of them are other divisions. Okay. So there was lot of like, everyone used to say like तुमने तो मतलब पार्लर का काम सीखा है, ठीक है? So okay, this is like something very different and very interesting. So you need to like understand like properly what your
Yeah, Dr. Sunanda.
yes,
Yeah,
sir.
yeah.
Yes. We are not able to hear you. We are able to see you. Yeah.
And
Yeah.
now it is fine.
Yeah, now it is fine.
Yes.
Yeah.
Yes, sir. I have introduced myself. Like
Yes. Now, what I want you to tell that why you were interested in cosmetology field right in the beginning, before your entry into ICLS. How did you decide? You know, cosmetology में करने का है, and out of Bangalore you decided to come to Mumbai. So how did you come to that decision? Can you tell us?
yes, sir. So there used to be most of them must be knowing, there was a TV show by known as Band Baja Barat.
Yes.
Remember in TV India it used to come.
Yeah.
So they treat a bride. They go for a cosmetic treatment.
Yes.
So
yes.
I saw, I would say Dr. Jamna Pai it was. Okay, she who was treating that lady. So I saw that. I used to like every day see it. Like if not every day, weekly, I think so. Once it was to come. So I saw that. Then I started searching about this thing. I searched in Bangalore, which I did not find. Okay. Then I came to know about ICLS. Then I messaged to sir and took an admission. Like it was all of a quick. As soon as I came to know about sir, I took a review. Like I saw the reviews and I just joined. It was in 2012.
Right.
August.
Almost, 10 years now.
Yeah, it is going to be 10 years.
Yeah, only 10 years. How the time flies, That's why I tell everyone, you take quick decision and start also quickly. That's what. And I will tell you about this girl, Dr. Sunanda. See, every student is different, but there is something in every student that I see that flame in your mind, in your brain, in your body, that particular flame of success. I see it in your eyes. Moment you call me, even if I am not able to see you, even if you are talking with me, I know if this particular inquiry doctor, he or she is really interested and they are going to have a big career in their life. In fraction of second, I come to you. And when you are come and sitting in front of me, that time though in half of a fraction of second, I know your future is going to be tremendous. And you should do all this also, that also. So many students, I tell them, you do 5 courses, you do all 10. Because I know you are going to go ahead with that. And see, that confidence, what happens when we start any new project? No, we are afraid. We have not seen the success. So we are afraid because all future pathway is dark. But the one who has passed through that, they know. Okay. I know what is lying ahead. I know what is going to come after 2 years. See now, did you imagine 3 years ago that we will be sitting on Zoom and Bangalore to Assam? I have a doctor from Assam. She has also joined. When she came, I have told her, Madam, do everything you can. And now you see, after 2 or 3 years, she will be in Hall of Fame. I am giving you written guarantee. I have got two other doctors, they are also lined up. So I will keep on informing you. And Dr. Sunanda, you want to say anything about your new devices which you are marketing and how it will help them? So you can tell about your...
So yes.
Yeah.
So we have bought this new device called as Pixel M Shape. Pixel Perfect Laser is my company's name, and one of the premium devices Pixel M Shape. When you hear the name M Shape, you must be thinking about body contouring, same weight loss, वो सब. ठीक है? It is not that. This is specially for people who are looking for building muscles. Okay, जिनको वो like who wants that six pack. Okay, they want that toned body. It is for them. It is like basically it will reduce the fat also, but it is like a person who don't want to go to gym. Okay, he is lying down and the machine is doing all the work. Okay, so it is giving in half an hour almost 20,000 crunches. Like if it is on the stomach you're placing, okay, it is doing 20,000 crunches. Okay, it is literally, you will feel that crunches, no, once you do the exercise, how you feel it, the same thing you will be feeling it. So this is like you can do on your tummy, you can do on your thighs, on your arms. Okay, you can't do on your back because back it is like fully bony area, you can't place it over there. So you can do on your calf muscles. Okay, there is one more seat along with it, which is known as like pelvic seat. Okay, so that is used for stress urinary incontinence. What is this stress urinary incontinence? Yeah, so after pregnancy, after a childbirth, okay, and after a certain age, women tend to pass urine involuntarily. Okay, they don't control on their muscle. A very common problem it is. So they don't discuss all these things to many people. Okay, they just suffer with that thing. So this muscles, no, you must be knowing naturally if you want to treat stress urinary incontinence, you do Kegel exercise. Okay, so Kegel exercise, but you're like inhaling and exhaling that perineum muscles. Okay, you can. So the same thing is with the device. You need to just sit on that seat. You will feel that vibration on your perineum muscles. So you can feel the 20,000 Kegel exercise you're doing in half an hour. Okay. Okay. So after certain age, even females have this vagina is very loose. Okay, because of that they face many issues like psychologically and physically. Okay, so this particular device helps in tightening of that. Okay, which is solving many issues. Okay, this is even for the men. Okay, so men also use it to increase that tightness in the perineum muscles. Okay, so it is even treated for ED, erectile dysfunction.
Right. Good.
So if perineum muscle is stronger, automatically your like ED also comes down.
Great.
Okay. Yeah. So these are the like common indication you can treat with this. So the what technology it is following is it is called as high fame. Okay. And it is also called as high EMT. Okay, that is high focused electromagnetic wave. Okay, so this leads to the tightness of the this muscle building and fat loss. Okay, so there are two things, like there are two devices in this. So one is for only for muscle building, like fat loss also will be there, which is not combined with RF. Okay, one more is with RF, that is high EMT and RF will work together. So at the same time, tightening also, fat loss also, and muscle building also. Okay, so see, in India there is one company called BTL, okay, who is marketing the same device, and they are like charging how much, 80 lakhs per device. Okay, so our device is like, I want to get it in very like same technology, same like this thing working function, and it is and the company which we have selected, the other devices also are very good of that. Okay, so we know how the results are. So it is very cheaper than that. You can say almost like 75% to 80% less it is, our device.
Oh, very nice.
In cost. So it is like very useful for like today's generation who wants that muscle building but don't want to work out.
Right.
Don't to work out. So it is very, very good for those people. And one more device is with for hair removal, and it is one of the like I tell powerful handpiece we have got. Why we call this powerful is, we need to, when you buy a device, you have to always see what is the watt of the machine. Okay. So our machine's watt is 3000 watt.
Okay.
And the handpiece is taking 2000 watt. Okay, so what it does is, when the watt of the device is high, so pain there will be less pain, it will be effective, and it would be even like results will be faster. Okay, when some devices, you must have seen now you get lasers for even 1 or 2 lakhs also. Okay, so the watt of that machine will be very less. Like you can see, like heart will be 400 or 500 watts. So अगर machine का watt ही 400 or 500 है, so how much will the handpiece take?
Right.
Result you will get, but in that you will feel that more painful. Okay, everything is like counts. So in our device, it is unlimited shots. There is no shot count. Okay, and we are giving like 2 years guarantee, and it has 4 wavelengths.
Okay,
so that's wonderful. 7. Yeah, that's 755, 810, 940, and 1064.
Okay.
So you're covering all the 6 types of skin, all the different kinds of hair, like blonde hair also you can treat, because 755 works on the hair which has like very less melanin, not the white hair I'm talking about. White hair can't treat, like electrolysis is the only option. Okay, it is the blonde hair that you can treat. And then coming to the 810 is the like standard this thing, it thick dark hair it will be targeting. 755 is very thin hair, it is targeting very thin shallow hairs. 940 again it will be targeting the darker hair which is very superficial. Okay, and 1064 it is for the darker skin type. Okay, so it is like safer for all the skin types or any kind of hair, like, okay, so you can treat with that. Okay, and as it is painless treatment, painless in the sense you have to feel that mild pricky sensation. Okay, and it has like both the modes, you can do both in the stamping technique and both the in motion technique. It has the hertz, you can go up to 10 hertz, that is in 1 second it will be firing 10 times. So based on how you're moving your handpiece, so we need to always understand like how the technician, how they are handling the device. Okay, sometimes what happens, a technician will who is working at your clinic, they might have worked with some device where they are doing in the stamping mode. Okay, when somebody is giving demo to you or something, they'll tell, nahi madam, ye acha nahi rahega, we used to do there like this. Okay, it is not like that, like you have to try everything. So this in motion technique, no, like many reputed companies they have, like most of them they have now. Okay, so in motion technique, what it does is you can finish the treatment faster.
Right.
Okay, so that is the one. And fluence you're selecting according to the hair type and skin of the patient. Since it is having the like you can measure even the cooling, how much the handpiece has become cold, like how it is, you can see on the screen of the handpiece. Okay, so that is one advantage in that. It is not that inbuilt you can see some temperature, you can externally also you can test that handpiece. Okay, you will see that it goes up to minus 65 degrees.
Oh.
Okay, so it is like the epidermis of your skin is like cold, but in dermis it is like it is heated up.
Yeah.
Okay, when we tell heated up, see, when you're delivering some energy in the dermis, what happens is the temperature of dermis, it goes up to almost 45 to 55 degrees Celsius. Okay, so that is sufficient to destroy that hair follicle. Okay, so soon after the laser, we should always suggest not to wash for next 4 hours or not to give cooling or anything. आप एनर्जी इतना मत दो ना कि मतलब आपको you need to do the cooling or this thing. You always go with number of passes instead of just giving one shot. Okay, give lesser fluence with more number of passes. So in that, what happens is when you're doing one pass, you have not seen the end point. End point is in hair removal, what you can say is erythema and edema of the hair follicle. So you have not seen in one pass. So next pass you're giving, second pass also you did not see that much, then you can go for the third pass. Okay, third pass you have seen, so you should work in that manner. So in this, what happens, you will never face a complication. Okay, and you will never face results also will be very good. Okay, always go with the end point. Parameters, like see, any laser, for example, any laser you are taking, company will give you a certain set of parameters. Okay, so you need to just understand the technology, how it is, like how it is working. That is very important. I would rather say don't follow, like initially you follow that parameters, but later on you need to set your own parameters, because for patient A is always different than patient B, and the skin reaction is always different. So always decide based on your end point. Okay, end point of the patient's skin. It might be any laser. Okay, so how we decide this now? How you have to decide the device, whether it is good or bad? You have to always see the pulse width. What is the pulse width the device is having? So how you have to, like, why pulse width is very important is, see, hair follicle, it has a CRT time. Okay, so hair follicle, what is CRT time? It is thermal relaxation time. But whatever the energy you have delivered, half of the energy it will release it, and whatever the half time it is to cool it down. Okay, so it is in milliseconds. So it is around 10 milliseconds to 100 milliseconds based on the different hair type and different area. This is the pulse width. So so that is the TRT time of the hair follicle. So same should be your pulse width of the
Yeah.
device. Okay. So you have to always, while buying any device, you have to check what is the pulse width of the device. Okay. So that your because once you're treating that particular cell or tissue, so it should react to it. Okay. As like I know, like everyone is practicing cosmetology now, so it is very important. Like we know the chromophores on
Right.
which laser is working.
So
So one
what
is,
your machine is that is multi-purpose with
pardon,
four
sir?
heads. Yeah, your machine is multi-purpose. Any type of scheme can be tackled for hair removal. Okay.
Yes, yes.
And that is doing only
It-
hair removal or any other thing also?
Pardon, sir?
Is it only hair removal laser or is it doing anything else also?
No, sir. It is particularly hair removal laser.
Great, great. So definitely,
It is
four
platform.
in one that will have a better advantage on other machines, because nowadays they are come out with triple pulse. If you are having
Triple wave.
four pulse,
There is one device you might have heard about, Milesman.
hmm,
That is the only device which has 4 wavelength.
okay, great.
Okay, remaining and it is quite costly.
Right. So, Dr. Sunanda, if you have any PowerPoint presentation, then you can
Yes.
send it to me on WhatsApp, and I will
Yes.
send it to all our participants by
Sure.
by tomorrow afternoon or evening. I can let them know that, and even if they want to purchase or they want to have any guidance, then you can guide them.
Yes, yes, sure,
Right.
sure. Now these two are the only product, like premium products.
Right.
We will be coming out with like portable devices also are there. Like if they want, like the doctor don't have that much of budget. Okay, they want to buy the device with lesser watt. So that also we have. And one more advantage is this 4 wavelength. It is FDA approved.
Okay, great.
This particular device is FDA approved. So that is like, it is what to say, like patient will not question you,
Okay.
like why you are treating with
Right,
this.
right.
But
Very nice. Great. Thank you, Dr. Sunanda, for giving us the glimpse of your successful journey. And now I want to unmute all. So whether I can unmute all by just one click, I am just, okay. Mute all. Okay, now all of you unmute yourself.
Yes, sir.
Okay, all of you unmute yourself. Dr. Vikas, Dr. Tejasvi, Dr. Akriti. Okay, asked to unmute. And I want you to do something. Yeah, is everybody unmuted?
Yes, sir.
Yes, sir.
Pooja? Okay. Right now. If you have any question, you can ask Dr. Sunanda right now. And please give her congratulations and wish her best luck loudly and clearly, all of you. Okay?
All the best.
thank
All the best. All the best. Appreciate your effort,
All the
Dr.
best.
Sunanda.
All the best.
Congratulations and all the best.
thank you so much, doctor.
Thank you, Dr. Sunanda. Now I want to tell you the final announcement, what we are proposing and what we are going to develop. That's what I am going to tell you now. We are going to have a Cosmetology Freedom Hub. I will repeat, it's a Cosmetology Freedom Hub in which all cosmetologists can practice with freedom. without any kind of fear. They will practice in an ethical way, and they can brand themselves, they can enhance their practice in very simple and cost effective ways. And you can have free time for yourself and for your family. That is the aim. So that is the meaning of freedom. And all cosmetologists will be in this cosmetology hub. Okay, it's a cosmetology freedom hub. There will be a lot of other facets, and I will be posting you maybe by 1st of May. We are planning to launch it, and all of you, those who are joining, no, all our students are free member to this cosmetology freedom hub. Okay, so more information I will send you later on. But by tomorrow or day after tomorrow, whenever Dr. Sunanda sends me her presentation, I will forward it to all those who have attended and to all my students. Okay? Right?
Thank you. Thank you so much.
Thank you for taking out your time on Sunday evening. See you physically in near future.
Yes. Like,
Thank you, sir.
Thank you, sir.
Thank you, Dr.
Bye.
Sunanda.
Bye. Thank you. Good night. Okay?
thanks.
Thank you for attending.
Thank you, sir. Thank you,
Bye.
sir.
Bye.
Thank you, sir. Thank you. Thank you, sir. Good
Bye.
night.